Hello, my name is Rajan Moon, and I am a consultant with HB 101 and the Minnesota Department of Human Services. And we're here today for a short overview training video on housing support, particularly when housing support occurs in the community. I'm really excited to introduce my colleague, Maya. Maya works in the Housing and Support Services Division at DHS and is a wealth of knowledge about housing support. So without further ado, Maya, I'm going to turn it over to you. Do you want to talk a little bit about what you do at DHS before jumping into the content?
Sure, I'd love to. Thanks, Rajan. So I'm Maya Urich. I work at DHS on the housing support team where I do a lot of our policy and training work. So when there are questions about housing support, particularly when a provider needs help or a county has questions or a person in the community wants to know more about housing support, I'm the person that can answer those questions. So I'm happy to be here talking about housing support in one kind of particular context using housing support in the community.
Great. Well, thanks so much, Maya. And if I have any questions, I'm going to jump in and ask Maya, but we're just going to let her go through the training. And keep in mind, we have a lot of excellent resources on housing support on hb101.org. We have some great information in our vault. We have brochures, some videos. And so without further ado, Maya, go ahead.
Okay, let's dive in. So today I'm going to give a brief overview of housing support. We'll talk about what it is in case you're not familiar, who can use the program, where can a person live while receiving housing support, but most importantly for today, thinking through a little more deeply, how can a person use housing support in their own unit or apartment, which is what we call a community setting. So quickly, some quick facts about housing support. It used to have a different name. Housing support used to be called group residential housing. It was a program intended to help people live in a small group setting. It still can do that, but we also have different places like the community now where people can live and use housing support. So we've updated our name. Housing support is a program that helps people pay for housing related expenses. People have to apply for the benefit through their local county or tribe where they live. And importantly, the money, even though it's a person's money that they apply for individually, it's not paid to the person. Housing support is actually paid to an eligible provider on behalf of an eligible person. I'm going to touch really briefly today on who an eligible provider is and who an eligible person is. Providers have a specific job to do with that money that they're paid, and places that people live have to be eligible. We have a lot of different places where people can live and use housing support. And I will talk mainly today about, again, a person living in their own apartment or their own single unit. This is not just for single adults. People can use housing support who are living with other adults or with family or with kids in the household. It's not just for single people, although it's a single person's benefit. And people can have a job while they have housing support as well. So this is the basic nuts and bolts of what housing support is on this slide. Housing support is a 100% state-funded income support program, also known as a cash benefit, to pay for housing expenses, and sometimes additional services can go with that. So whenever we're talking about housing support, we're talking about a room and board payment. And this slide is the current numbers. So our fiscal year for the state of Minnesota changes every July 1st. So these numbers will change every July 1st. Currently, for the next about month or so, month and a half, our room and board numbers are $1,041 per person per month in a group setting. So that's places like assisted living facilities, board and lodges, adult foster care, etc. And then $1,091 for people who are living in supportive housing, which means somebody who has a lease and lives in their own unit, like we're focusing on today. We serve approximately 20,000 people across the state every single month, which is pretty incredible. And some of the people who get housing support also get what's called the supplemental service rate. That's typically an amount of $482.84 per person per month. Some providers get paid a little more than that or significantly more than that if the legislature has carved out a special amount for that provider. But that's only about 30% of the people who have the program as a whole get that service rate. Now, I have a very similar slide following this just to give you the new numbers for when our fiscal year changes. So like I mentioned, July is coming up. So starting July 1st of 2023, we have new room and board amounts. You'll see the service rate did not change, which I think might be outdated information. I think I might be behind the curve already with the legislative session just wrapping up. There might have been a change to that service rate. I think it was a really small one. So providers might be getting a few more dollars than that 482.84. But that's the number I'm aware of currently. And then starting July 1st of 2023, room and board is going up. So people who are living in group settings will receive $1,135, and people who are living in community will get $1,185 for their room and board amounts. What that money pays for is really specific. So that money is intended to help people pay for the space and the stuff that they need for their housing. So that means 3 nutritious meals a day, a bed, clothing, storage, linen, bedding, laundry supplies, housekeeping, including lavatory supplies or service, and the maintenance and operation of the building and grounds. So those are those room and board dollars. That's what they're paying for. This is the floor, not the ceiling. And what I mean by that is that providers have to pay for these things or have to make sure these things are present for a person. But there are other things providers can also purchase or expenses that they can cover with housing support dollars above and beyond this list that are allowable as well. I won't go into all of those. The supplemental service rate, we have similar standards, kind of minimum standards, where a provider who's getting that service rate has to make sure that they're connecting people with resources that they need to stay stable in their home and case note what they're doing. Other things that service rate can pay for is general oversight and supervision, arranging for medical and social services, assisting with transportation, and other if the legislature has given them other jobs. So that's really the basics of what housing support is. And we can go into now who can use it. So we need to have an eligible person, provider, and place in order for housing support to turn on for a person or to be authorized. So an eligible person has to have low income and low assets. Both of those things have to be true for a person. And the low income, I don't have a hard number for you because it can be a little bit different depending on where a person is living and if they're getting the service rate or not. So just know that a person's income can't be higher than the benefit that they're getting through housing support. So in general, after any deductions that they get that the county would calculate, a person's countable income has to be at or below the housing support rate that they'll get. And then people have to have low assets. Our Minnesota programs have an asset limit of $10,000, but people should be aware that if they're on federal programs like medical assistance or SSI, they have to abide by a much lower asset limit of $2,000. Beyond what I just mentioned on the previous slide about low income and assets, those things have to be true for everyone. Plus, everyone has to have one of the following basis of eligibility. So people have to either have an age of 65 and older or a certified disability, which means they've gone through the process at a government level to have their disability authorized or certified. Or a person could have a disabling condition. The disabling condition means they've been seen by some sort of qualified professional or designee of the county who signed off on a document called the Professional Statement of Need. And that statement of need, there's a few different conditions that a person can have that are checked off by that qualified professional. And that document is enough for us to turn on housing support for a person. It's not a diagnostic tool. It's not a certification. It's simply an eligibility document called the Professional Statement of Need. And then for a second, I'm going to throw out everything I mentioned and say we have a new basis of eligibility where none of that has to be true. for people who are exiting residential behavioral health treatment. So if someone is leaving a residential crisis stabilization facility, an intensive residential treatment service facility, or inpatient substance use disorder treatment, they can access housing support without proving they have low income, without proving their assets, their age, or their disabling condition, as long as they have nowhere to go. So if they're leaving that treatment facility and they have no stable nighttime residence, they're able to get housing support for a short amount of time, for up to 3 months, without having to pay in toward their housing. Typically, if someone has some sort of income, they have to pay a portion of that income toward their housing costs in order to stay on housing support. But in this case, for people who are leaving treatment, we don't ask any of the usual eligibility questions. We just turn on housing support for up to 3 months for that person so they can get their feet under them, take a breath, and figure out what they want to do from there. After that 3 month period, they will have to apply for housing support the traditional manner. So they will have to verify that they qualify to continue getting the benefit. But just know that this is a really great way for people to access housing support in a quicker, easier way if someone's leaving treatment and has nowhere else to go. So that's eligible person. We're going to talk briefly about who an eligible provider is. So in order to be a housing support provider, an organization has to have a signed standard housing support agreement with the county or tribe where they're operating. So like I mentioned, there are group settings like assisted living facilities, board and lodges, adult foster care, and we have supportive housing settings where people can live in their own apartment. That doesn't mean that anybody living in their own apartment can get housing support wherever they go. They have to have a housing support provider with a signed agreement with the county or tribe. Same goes for those group settings. Just because people could live in an assisted living facility and get housing support doesn't mean every single housing support, or I'm sorry, every single assisted living facility has that agreement. So just note that that agreement has to be in place. Counties don't have to sign agreements with providers if they don't want to. They need to make sure they're doing their due diligence to oversee providers. So they have to make sure they have capacity enough to oversee all the providers under their oversight. So providers or counties might not have capacity. Counties also might have goals in mind for their housing that don't align with what a provider is doing. So they don't have to work with a provider if they don't want to. The housing support agreement is updated every year. It's not transferable. It sets those minimum standards I outlined for you earlier in the presentation. It authorizes how many people a provider can serve and establishes the rates that they'll be paid. So far we've talked about an eligible person. This is an eligible provider on this slide. And now let's think about places. So when people think about where they can live and use housing support, HB 101 Places is a really great tool in order to think that through. So it's great for people who are looking for housing with supportive services. One location, it's one kind of one-stop shop to look for housing support openings. You can filter in HB 101 Places based on what you're looking for. And it's great for providers because it allows a place to find all of the folks who might be looking for their housing and minimizes those calls or all the work to fill a vacancy. I'm going to show you a screenshot here. There are many different types of housing that show up on HB 101 Places, such as our group settings, like I've mentioned, board and lodges, adult foster care. We now have assisted living showing up here, only housing support openings. And we do, I believe, now have site-based supportive housing showing up here. So if you want to live in your own apartment, you could potentially see those openings for site-based locations on HB 101 Places. There's one drawback to HB 101 Places currently, that scattered site programs. So providers who help people move into apartments with a landlord in the community that maybe your neighbors don't have housing support. So it's really just a mixed building or any kind of opening you might find. Those openings don't show up on HB 101 Places yet. They will. We're working on it with our consultants and with our web designers. But that's something that won't show up on this website yet. So if that's what you're interested in and is kind of the focus of today's conversation, that's something you really want to talk to your county or tribe about to get a list of the providers that are doing scattered site housing support. And that's what you want to ask for. The language that you want to ask for is a scattered site community housing support provider. Who is that? Who are the providers doing scattered site housing support in my area? And they can get you a list of those providers and potentially the referral pathways to get one of those openings. I'm going to address that in a second, but it's not always as easy as it should be. So where can I live and use housing support? I can live in group settings, which is where there's a meal provided by the facility, or my meals are provided by my facility. There's no requirement to use a lease, at least for housing support purposes. And the setting is licensed or registered. It has some sort of state licensing involved or local licensing involved. A community setting is what I'm really focusing on today, where all residents have to have a lease agreement. It's not time limited, so we can't say, the provider can't say you have to leave in 2 years or a year or 6 months. You should be able to have that housing as long as you'd like to live there. There's some sort of support service in place that doesn't have to be formal. It could be, but you have to have some sort of support in place to call it supportive housing. And it's exempt from licensing and state law. And the reason it's exempt from licensing is because often it looks like an apartment that anybody could rent. And we don't ask that an apartment building is licensed. We ask that that person is protected by a lease, and there's a document called the habitability inspection that has to be submitted with the person's application. And that helps make sure that the place is safe for human habitation. So the big question, how do I use housing support in my own unit or apartment? So the first thing to know is that you have to have a provider in place before you can move in to a unit and use housing support. So although you might think, oh, I'm going to look for housing, I'm going to find my own apartment, and I'm going to make housing support work from there, I really encourage anybody listening to this to know that actually the first step should be identifying who a housing support provider with an opening is who's willing to work with you. Most community-based housing support across Minnesota right now uses what's called the long-term homeless model. And that's because providers get a service rate to work with the clients in that program. So folks have to meet the long-term homeless definition in order to be part of that program or use a housing support opening. Many counties and tribes, or I would say most at this point, require that those long-term homeless programs are referred through the local coordinated entry system. So all of this is to say that most places where you could get your own apartment and use housing support, you almost always have to go through coordinated entry, meaning you can't track down an opening yourself. It has to come up through that waitlist process. Not everywhere and not always, but almost always that's the case. Because this is different locally, we allow counties and tribes to have their own rules around that. I really encourage you to call your county or tribe to ask how community-based housing support works in that area. There might not be any providers who do that work. We don't have housing support providers doing community-based settings in every county, unfortunately. We're always working to spread that resource, but it doesn't exist everywhere. So just know that calling your county or tribe is really a great place to start if you're not sure how to get a housing support provider. And then continuing that question, how do I use housing support in my own unit or apartment? So that first step is to identify a provider. You might be able to track one down yourself, but you might also be referred through the coordinated entry system. And that provider will help you find a local unit or apartment to move into. Once you move in, the housing support provider will help you complete an application and submit it to the county or tribe where you're living. So note, my biggest message today is that if you're doing an apartment search and you find a landlord or a property manager that says, we accept housing support, we accept GRH housing, that is not enough. You cannot move in and be able to get housing support at that location unless you have a housing support provider working with you. If you move in and you apply without that provider in place, your application will be denied. You won't have that benefit to help you pay for the rent of that unit. So that's my biggest message today, is that you need a housing support provider. And that is the last slide that I had for everyone today. I encourage you to contact me if you have questions. My contact information is on this slide. Rajan, do you have any questions as I wrap up?
As I was going through the training, had some questions appear in my mind, and then
Great.
you answered them.
Oh, good.
So,
Good.
so thank you so much for your time this morning, Maya. I think this was a great introduction to housing support. Housing support is a very powerful benefit, but it is, as you can see from Maya's presentation, also pretty complex program, that helps people with their housing. So reaching out if you have questions, going to either your county or your tribe. You can also go to hb101.org, read the article on housing support. You can chat and call Disability Hub MN, and they can connect you to experts in housing support as well. So again, thank you so much for your time this morning. And thank you, Maya, for this wonderful training.
Awesome. Thank you so much.